Welcome to the Maternity Mentor. Today we will be talking about the warning signs of placenta previa and what you can do to protect yourself and your baby. Stay with us. Hi, I'm Samantha. I'm a board-certified nurse practitioner and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Placenta previa occurs in about 1 out of every 200 births. Let's explore what placenta previa is and how it can affect your pregnancy and delivery. The placenta is an organ that attaches to your uterine wall and has a cord that comes out from it and attaches to your baby's belly while you are pregnant. The purpose of the placenta is to feed your baby and provide your baby with oxygen. It also removes wastes from your baby's body via blood flow to and from the placenta. Normally, the placenta implants and is positioned away from the cervix, usually in the upper part of the uterus. The cervix is the opening from the uterus to the vagina. A placenta previa is when the placenta covers the cervix and can also be called a complete previa. If the placenta is near or partially covering the cervix, it may be referred to as a low-lying placenta. Unfortunately, the causes of placenta previa are unknown, but there are risk factors that have been identified. Risk factors that increase your chances of developing placenta previa include: you are 35 years or older, you have an ethnic background other than Caucasian, you use cocaine, you smoke cigarettes, you have been pregnant before, you are pregnant with multiples like twins or triplets, you had a previous placenta previa, you had in vitro fertilization, you have an abnormally shaped uterus, or you have had a prior uterine surgery. These surgeries include a cesarean section, a fibroid removal, or dilation and curettage, also called a D&C. A D&C removes tissue from the uterine lining and may be performed if a woman has a miscarriage. Once you have had a placenta previa, your chances of developing another placenta previa is 2 to 3%. The main symptom of placenta previa is bleeding. Usually it will present in the second trimester as painless bleeding. This bleeding will be bright red. Sometimes a woman may have some contractions associated with the bleeding. If you do start bleeding, you should contact your healthcare provider immediately so that they can evaluate you. If the bleeding is severe, you should call 911 or head to the nearest emergency room. However, approximately 1/3 of women with placenta previa will not experience bleeding. Placenta previa is diagnosed via ultrasound. The ultrasound may be abdominal or on top of the belly, or vaginal, where a small ultrasound wand is inserted into the vagina for better views of the uterus and placenta. Most placenta previas that are diagnosed via ultrasound without any symptoms will go on to resolve on their own. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about the complications of placenta previa. There are several complications that can arise from having a placenta previa. For starters, bleeding is very common and can become heavy. This can lead to anemia or postpartum hemorrhage, triggering the need for a blood transfusion. Placenta previa can lead to placenta accreta, which is a placenta that is implanted too deeply. This can prevent the placenta from detaching at delivery, leading to massive blood loss and the possible requirement of a hysterectomy to stop the bleeding. Placenta previa often requires birth prior to term, which means your baby is at risk for complications related to prematurity, including breathing issues and being low birth weight. Finally, there is some evidence linking women who experience preterm birth due to placenta previa as being at higher risk for preterm birth in subsequent pregnancies. For more information on postpartum hemorrhage and blood transfusions during pregnancy, please see our videos on these, We will link those in the description below. There is no cure for placenta previa. In many pregnancies, as the uterus grows, the placenta moves further away from the cervix, causing the placenta previa to resolve. If this does not happen, the focus will be on managing your bleeding. When bleeding is minimal, your provider will most likely recommend rest. You will be advised to avoid activities that can cause contractions, like sex and douching. You will also be asked to avoid activities that could trigger bleeding, like running, squatting, jumping, or exercise. Your provider will also educate you on what to do should you begin to bleed. In most cases, once the bleeding is seen, you should head to the nearest hospital to be checked out. For heavy bleeding, hospital monitoring and treatment will be required. You will probably receive blood transfusions for yourself to treat the blood loss and resulting anemia and instability that can arise. Your provider should offer you corticosteroids, which is an injection that helps develop your baby's lungs in case delivery happens prior to 37 weeks gestation. You may also be placed on magnesium sulfate, which is a medication used for neuroprotection of preterm infants if delivery is expected imminently. If bleeding does not stop or cannot be controlled, an emergency cesarean section will be performed to stabilize you and prevent fetal distress in your baby. If your placenta previa resolves during your pregnancy, both vaginal and cesarean section delivery options should be available to you. When the placenta remains low-lying, your provider will perform careful assessments during the final weeks of your pregnancy to determine if a vaginal birth can safely happen. These assessments will usually include ultrasound to determine the baby's position, the baby's weight, and the position of the placenta. Your provider should spend time counseling you on the risks versus benefits of both a vaginal and cesarean delivery when you have a low-lying placenta, so that you can make an informed decision about your plan of care. The goal is to keep you pregnant as long as possible, with delivery of your baby happening after 36 weeks of gestation. Complete placenta previa requires a cesarean section delivery because the placenta will usually detach during dilation of the cervix, and this causes your baby to hemorrhage, leading to fetal distress and death. Severe bleeding between 34 and 36 weeks gestation will usually require an emergency cesarean section delivery. At 36 to 37 weeks gestation, your provider may perform an amniocentesis to test the maturity of the amniotic fluid. If your provider feels your baby is mature enough, they may recommend immediate cesarean delivery prior to another bleeding episode. Placenta previa is a serious condition that can cause massive bleeding and dangerous complications. I hope this has explained what placenta previa is and what to expect should you develop one during your pregnancy. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.